Now, health chiefs have raised the alarm over record numbers of children now receiving eating disorder treatment, with London seeing a near fivefold jump in the number of young people waiting for treatment. 2 years ago, we spoke to Hope Virgo about her campaign, #DumpTheScales, and her lobbying the government to raise awareness of the problem. And she joins us again now. Hope, welcome to you. Thanks very much for being with us. What is this sharp increase down to, do you think?
Thanks so much for having me. So personally, I think it's probably due a lot to the pandemic. We've had a year of real uncertainty, of real isolation. But I think looking beyond that as well, it is an issue that is affecting so many people on a day-to-day basis. And I do feel like right now we're blaming the pandemic a lot. We're kind of hiding behind it. And we probably had a lot of these numbers out there before, people functioning at a very high level, but we were just not really sure what was actually going on for individuals.
And now you're a campaigner based on your own experiences of suffering from anorexia. When you joined us on the programme 2 years ago, back then you asked for existing NHS guidelines to be enforced so that medical professionals are better informed and able to stop turning people away who are suffering from this. Do you think anything has actually changed?
Really good question. So there has been some progress. I think it's been very, very slow. There has been some investment into services. The government have invested money into early intervention models, which is great to some extent, but the money is not being ring-fenced. And often what's happening when we are looking at eating disorders is we're either looking at this kind of early intervention factor, or we're looking at these people who are at crisis point. So we're missing this massive cohort of people who fall in the middle, who are functioning at a high level with an eating disorder, who cannot access any kind of services, any support at the moment. And to be honest, like, people are still dying on a day-to-day basis as a result of eating disorders. So I think there is still a huge amount that needs to be done. The government still often think of eating disorders as something that affects white teenage girls, something that people grow out of, a choice that people make. And so we need to be actually looking at how we can properly tackle that stigma and invest into services with a proper timeline for implementation.
OK, well, let's put those points to our politicians. Stephen, what's your reaction?
Well, Hope's right. There's been some investment in services, I believe £53 million per annum for children and young people's eating disorders, and also a large sum of money towards the wider issue around mental health. But access to services is always a challenge for healthcare, and then people need to approach their GP or their local community eating disorder service or use the Beat helplines. It's bad access to service that I think is absolutely critical. Karen?
Congratulations to Hope on this campaigning, and I think she's hit on something very important, which is there is a bit of a tendency to see eating disorders as somehow a sort of narcissistic condition, and just about kind of body image, and actually not see it as a very serious mental health condition. And certainly she's also right in saying that people in that kind of middle category, sort of not quite crisis and not quite early intervention, are often missed out. And there's another really big problem, the way that mental health services, a number of services, tend to struggle when they're crossing over between childhood and adult services, and people often get lost in the middle. If we're going to recover out of this pandemic properly, we need to make sure that there is enough investment in the mental health services, including eating disorders, to help people recover, because the hospitals are telling me, my hospitals are telling me, there's been an absolute surge in all kinds of emergency presentations for mental health conditions, and that is going to need not just kind of business as usual, but something that's really focused on the mental health consequences of the pandemic, which has exacerbated so many underlying problems.
Hope, many people will be shocked that anorexia has the highest mortality rate of any psychiatric illness. What can specifically be done to try and reduce those figures?
So it's about reaching out for support. It's about making sure there is the proper early intervention there for people. It's about empowering and encouraging schools, communities to start having more of these conversations, and making sure that when you present with an eating disorder, with disordered eating, with an exercise dependency, that when you go to your GP, you're being met with support and services out there. Yes, services are really, really overstretched right now, but actually we need to be taking this really, really seriously. I would argue that we are in a state of emergency around eating disorders, and that frontline support, that kind of initial conversation with the GP, can actually either cause the person person to get the support they need and feel heard, or cause them to kind of go into this really competitive mindset and really, really struggle further.
OK, Stephen, just very briefly, this is a state of emergency. Is it being dealt with properly by the government?
Well, it is an emergency, and I believe that we are making the investment into services, but we also need to make sure that the pathways are there so that people get get access to what they need.
All right, thank you. Our thanks also very much to Hope for joining us on the programme.